All right, I've got my baby doll with me today because we're going to talk a little bit about birth and head shape and post-birth health, because really this is so largely overlooked that I have patients coming in here on a daily basis having no idea that what happened in utero and also during the birth process would have a large play into their child's health, into their child's future, into its brain development, into their senses, into how they're wired. It's a big, big deal. It is the most overlooked thing so far to date that I have encountered. I mean, it's bigger than toxins, you guys. It's really a huge, huge deal. So here's why I'm bringing this up. I had a patient come in who is almost 3 years old, and she has been absolutely everywhere. Her parents are bound and determined to figure out how to help her the very best. She has had MRI, she's had ultrasound, she's had x-rays, she's been to the physical therapist, neurologist, physiologist, she's been to speech therapy, occupational therapy, and physical therapy on a regular basis. She wears AFO, so you know, if you know what those are foot orthotics, ankle foot orthotics. She's a toe walker. She can't walk yet. She holds on to things and stands. She has no words, or very few words, I should say. And she still has what people consider, or the layman's term, stork bite, birthmark. And we see them in a couple different places. You can see them on the forehead. It's that red rash looking thing, but it's deep into the skin, or in the back of the neck. And I know that it can be cute, and we can call it a birthmark or a little natural tattoo or whatever it is that we want to call it. She also has one on her arm. But that's actually pressure that was happening in utero as the baby was developing. And this is a really big deal, because movement is life. Movement feeds the brain. That is how the brain develops. Movement is what develops the brain and the neurological connections. Movement is what your brain is perceiving at any given moment. 90% of what can bog down our system is knowing where we're at in time and space. And that motor development, our brain is largely mechanoreceptor driven. That means movement driven, needing to be able to develop. And every single milestone matters, from being able to hold up, nurse and latch, hold up the head, crawl, walk. All of those things are largely important into brain development. And since she never crawled, and she really can hardly hold a bottle, and is unable to talk, and is extremely stressed and afraid of doctors because she's been so poked and prodded. This has been a pretty big deal, and this has been a long search for their parents, and no one tied this back to how she was in utero. And she was a frank breech. So if you guys know what a frank breech means, it means that she was butt down, legs up on each side of the head. And like I said, she had a large mark on the front of her head, and mom said that she was so uncomfortable during the birth that she, on her side of her ribs, that she actually couldn't even wear a bra. There could be no compression there. And it was enough pressure that it left a mark on her daughter's head. Now here's the biggest deal with that. When they're lodged into the pelvis like this, and the deeper they get, the bigger they get, and they don't move, they're not getting that movement in utero like they need. That's very similar to interuterine growth constraint. And we know anytime that happens, that becomes an emergency for patients, emergency cesarean section and emergency induction. Interuterine growth restraint is a big deal, because we know the brain is unable to develop appropriately when that happens. It can start restricting a lot of things developmentally. So the doctors did think that this little girl was head down the whole time, despite mom's discomfort and feeling like something was wrong, and they induced her. Well, here's another thing that an induction does, especially with Pitocin. It is an unnatural just squeeze down onto the uterus instead of a nice rhythmic one that our natural contraction has. So her daughter was being just pressure and squeezed down deeper and deeper into this pelvis, and to the point of being lodged in here like this so far that when her mom started dilating to push her out, and I can't even get this baby in that far, they realized it was actually a butt and not a head coming out. And they needed to stop the contractions because they were unwilling to deliver a frank breech baby. I know they did in the 80s and the 90s, but there's been a lot of medical doctors that don't want to do that anymore in fear of the head getting stuck on the last little bit coming out. So what did they have to do? They had to medicate again and stop all of the contractions. That's typically a really heavy dose of magnesium to get every soft, smooth muscle to stop contracting in order to do a cesarean section. Now the contractions had been really intense. They had to give her a very large dose to counteract the labor that she was in, and then give her some more medication, a spinal, in order to deliver this baby via cesarean section. And then once again, they're kind of pulled out however they can get them. Sometimes they have to turn the baby to be able to pull them out by their head or neck, and other times they have to dislodge the baby. And I've had moms even tell me, you know what, this is gonna look like I'm doing CPR on your body in order to push your baby out. Now, when you sit down and talk to a parent, I haven't met a single one yet who is willing to let something like that happen to their child, that amount of pressure, that amount of pulling, those amount of drugs, post-birth. No one would ever do that. So we have to consider the fact that this is gonna play into their health during this labor and delivery process, during uterine development in these little ones. It really plays a huge factor into how the brain's going to develop. Now, this little pumpkin, I looked through all of her MRIs and x-rays and ultrasounds, and she had absolutely no structural abnormalities, yet the medical doctors were looking at adding in more drugs, adding in Botox to her legs because her legs were too tight. She's a toe walker, and this is not the first time I've heard of using Botox into a muscle. Now, if you know what Botox is, that's a botulin virus that they're putting into a muscle to paralyze it. That's what botulism does. So Botox paralyzes the muscle. That's why people choose to do it in their face, to reduce the wrinkles. Not something you're going to want to do into a developing muscle, especially of a little one that hasn't even walked yet, or other little ones that have had the same motor skill development challenges, both gross and fine motor. Not a really good choice. Heavy doses of non-steroidal anti-inflammatories, also not necessarily a really great choice. We gotta look for the cause, not the symptoms, not the effect of the stress. And what I found in her MRI was a ton of brain cord tension and pressure. Brainstem was tense, the spinal cord itself was tense through the cervical spine, even changing the signal in the MRI. And I knew, chiropractors call it a subluxation, that there was so much stress in her brainstem that it was unable to get the feedback. So even if she hadn't been severely stuck like this, and her pelvis still appears to be very stuck, these joints are not moving well, and there is no actual bone malformation at all. It's just very stuck and there's no movement here. She can't get the information back to her brain here. And this area of the brain near the brainstem, if you remember from any of my previous videos, or you haven't heard me talk before, we know that that's what feeds the brain. That brainstem area has so much vital information at the top of it. There, at the top of the neck, right there is the brainstem. We know, even looking back at Superman, he broke that first cervical vertebra and lost all function beneath. Until he had a surgery, he was able to breathe somewhat on his own. I mean, it's a pretty big deal. So just a little bit of tension, just enough for the brain to not get feedback is of course going to affect everything beneath. Her digestive tract is off, her sleep is off. I mean, there's a million things that's going on wrong with her. The parents are very concerned with her inability to walk, her inability to communicate, and her constant crying and discomfort. So they found the right place. They're really excited. I'm really excited. It's going to be a journey because she's almost 3 and she's been developing this way since in utero. But the great thing is the brain is always changing. It can always adapt. We know Harvard has that graph that I show often where we look at the body's and brain's ability to change. It goes all the way past 70 years of age, and the energy it takes to do so, much less from birth to 3 and even birth till 10 than it is 10, 15, 20 years on and beyond. However, it can change and it can adapt, and the stress can come off, and it can reconnect, and it can start communicating appropriately with that lower motor system and function. And we are gonna follow this girl through the process. I want to send you guys video updates on her, because this is going to be something that's super amazing. But I need more parents to know, and more moms to know about the birth process and how it can affect their child and their health and development. We do webinars. We also do live events called The Perfect Storm. We are talking about focus and sensory right now has been our theme, but we're going to also do webinars on motor development and head shape and latching and nursing and postpartum health for mom and emotional support for parents and school support for kids. So stay tuned, follow us. We'd love to have you. You can join us on perfectstormidaho.com, check out our website, purposedrivenchiro.com, and get some more empowerment and get some more education for you to help your family. Thanks.